At the risk of being shamelessly self-promoting, I just want to point out that one of the things that we found in our environment that can be absolutely of great assistance in terms of helping patients stop smoking is developing some systematically applied protocols that allow smoking cessation interventions to be delivered. You know, we used to go through this annual existential crisis in our smoking cessation program at the Heart Institute because people would get together and say, gee, people are canceling, they're not showing, canceled this and da-da-da-da, and we're only seeing a couple of 100, 300 patients a year. And then one day somebody said, well, you know, we see 2,500 to 3,000 patients who are smokers every year in the Heart Institute on floors 3, 4, and 5. And guess what? They've got diminished renal function, their blood sugar's a little out of whack, their cholesterol levels are elevated or their blood pressure is high, lights flash, bells ring, teams of residents descend upon them, and the latest hypertension control and dyslipidemic management strategies are applied, and if they're not, heads roll. And what do we do about smoking, which dwarfs those other cardiovascular risk factors? Well, it might have been a serendipitous, gee, I see you're a smoker, gee, have you ever thought about, perhaps you might want to think about, have you talk about it with your family physician the next time, if you got one. And indeed, if you go to most Canadian hospitals still and ask, gee, how many of your patients admitted to your hospital are smokers, given that this is Canada's leading cause of preventable disease, disability, and death? And there's usually an embarrassed silence. And if it is collected, it's collected in a haphazard manner and leads to misperceptions. So out of that came this whole thing, which eventually evolved to be called the Ottawa Model for Smoking Cessation, which just meant that we do ordinary things extraordinarily well. We identify the smoking status of all patients. It has to be documented. The protocols are in place. This isn't a nice, it would be nice if we did. This is part of what happens. We get your phone number, your residential address, da-da-da-da-da-da-da, and we also inquire, not are you a smoker, but have you used any form of tobacco in the past 6 months? Have you used any form of tobacco in the past 7 days? And then and only then do you get an accurate representation of smoking status. Because many of our patients decided 48 minutes earlier on a gurney in the angiography suite that they were now a non-smoker. And so their answer is not intended to deceive, but an opportunity to affirm that new naively acquired non-smoking status. That identification and documentation then triggers an offer of assistance involving counseling, behavioral support, and pharmacotherapy, and then we follow these patients up in some ingenious ways. But it's all about, and I repeat myself, doing some ordinary things extraordinarily well. And as a consequence, we were able to show that we were significantly improving our rates of smoking cessation. We also spent some time disabusing many of our colleagues, many of whom were firmly entrenched in the Presbyterian approach to smoking cessation, that they could efficiently and effectively begin to address this issue in as little as 26 seconds. By simply saying, you know, Mrs. Brown, since you've had your heart attack, it's important we both understand that the most important thing we can do is to help you stop smoking. Boy, I know how difficult that can be, and I'll bet you've struggled with that in the past, but here at the Heart Institute, we've got a process and some programs which I think will be very helpful to you. We're going to offer you assistance in that way, and I hope you won't ever hesitate to ask for our assistance. And this is just so important. I'm going to inquire about this every time I see you from now on. End of story. 26 seconds or less, I hope. Right? As opposed to, don't you want to see your children graduate from high school and have you no idea what's happening to the endothelial surfaces of your major blood vessels, to say nothing of auto-regulation of your coronary vascular, blah, 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 right? Fact one, the overwhelming majority of Canadians who are smokers know why they shouldn't smoke. The majority don't want to be smokers, and a very substantial proportion will make 1 or 2 personal private quit attempts each year, 95% of which will fail. So rather than providing interactive CD-ROMs and colorful posters and fridge magnets and providing you with information about reason number 194 why you should stop smoking, we as clinicians should actually be providing assistance in a very sympathetic and strategic kind of manner.